Item 5B, COVID-19 Instructional Plan Update, Dr. Gandhi and Dr. Newman.
Sure, thank you. Okay, I'll try to be brief. We met yesterday morning and we are just regrouping to see how things are going since our district returned to full in-person instruction 5 days a week on January the 19th. We started with our Cass County data and it was pretty much all good news. As I'm sure you guys have seen, our positivity rate, our hospitalization rate, and our mortality rate are all trending down, significantly so. Our new positives per day rolling average is improved to 19.93 per day, and our 14-day positivity rate is the lowest it's been since September at 2.27%. Our COVID-19 hospitalizations are down. We were currently sitting at 39 hospitalizations statewide, and I believe we're at 8 here in Fargo, so quite low. And the majority of those remain to be people with underlying conditions or from long-term care. As I said, the deaths from COVID are down. That's both in Cass County and across the state. Our January numbers were much lower than previous months that we had seen. We did not see the Thanksgiving or Christmas spike, which many states did experience, so we are grateful for that. And our highest active cases in our state continue to be in that 20 to 29-year-old age range. But interestingly, the lowest active cases are now the 80-plus range, which is good news. And the next three lowest groups are all children, 0 to 5, 6 to 11, and 12 to 14. There was a reminder that Buy Next Now testing is still readily available for Fargo Public Schools staff. They reported that overall testing has decreased and they see less symptomatic people coming to get tested, which is positive. And then there was discussion about the vaccine rollout. It's estimated currently that 11% of Cass County residents have received at least one dose or the first dose of the vaccine. And we are currently working our way through priority group 1B. I'll talk a little bit more, but educators are at the end of that group and they're kind of at the early stages of that group. I'm probably not going to go through all this. I tried to do it in chart form for you guys so you could just visually see it. But then Doug presented the FPS staff data, and this was as of Sunday morning. We had one staff member test positive the previous week and 3 staff out due to positive tests. So you can see the breakdown there, but the numbers are very, very low, 0 for most areas. And then staff quarantine numbers also quite low. They're listed there. I thought I'd touch on our substitute fill rates. That was also good news. We tried to break it down by elementary, middle, and high school. Thank you, Doug, for all this information. But the total teachers, you can see percent unfilled for 2021, we're sitting at 9.34%. And the next column over is percent unfilled to 2020, which is 13.9%. And then the para-educator data is there. That is probably the area we are still struggling to fill the most, but it doesn't seem to be drastically different from previous years in non-COVID times. And then we had our Fargo Public Schools student data presented. This was as of Sunday evening. 13 students are in isolation due to a positive test. Current active cases are very low, 2 cases in elementary, 6 cases in middle school, 5 cases in high school. And then student close contacts, there was a total of 262. It's important to remember that these can be close contacts in the home, community related, or school contacts. We don't know the delineation of that. And then student close contacts that were in quarantine due to not wearing a mask were 77 out of that number. And then we discussed the vaccine rollout and what that's going to look like. As I said, we're currently in the early stages of Group 1B. Educators will be at the final stage of 1B, and it sounds like they will work their way through a randomized order between the 3 groups I previously talked about, having to do with your amount of contact with students, etc. And then Dr. Gandhi asked for input from the teachers on the committee and just how are things going now that we're back in 5 days a week. And surprisingly, all the reports were positive and good. It was stated that overall things are going really well. There was a lot of thanks given to parents and custodial staff for all the extra help. Students mostly are doing what we ask of them. There were some reminders needed to wear masks properly, mostly at the high school level, a lot of below the nose situations. And then the staff is still just feeling anxious about when the vaccine is coming. And then students were glad to be back, it seemed, at all levels. So our plan is to continue in the modified level 4, which we're in now, and slowly think about working toward the new normal or level 5 instruction. At this point, it's just sort of seeing what works and what doesn't work. The feelings will continue to be conservative and continue with things like virtual teacher conferences, limiting large group gatherings, no field trips, etc. And we'll continue to monitor our mitigation strategies and just modify as we're able. There were no votes at the meeting, and we decided to meet again in a month on March 8th, right before spring break. With that, I'm happy to take any questions.
Thank you for that thorough report. Any questions for Dr. Newman? Okay, you covered it all. We have no questions. Okay, next item is